Happy Thursday, everybody. So, surgical technology is fun, and we're going through another phase in surgery where we're seeing some new and exciting things come out. And I'm usually somewhat skeptical and reluctant of new things as they come out. However, I think this newest technology is really going to make a big difference in our particular practice and our patients. So, we're happy to announce here at Ultimate Bariatrics that we were the first surgeons west of the Mississippi that do bariatric surgery to use and embrace magnetic surgery. This is a new technology that is based on magnetism that allows us to perform our operations with fewer incisions, less pain potentially, and less trauma to the internal organs. This technology is developed by a company called Levita, and I'm not on their payroll or anything, so I'm not getting a kickback for giving a commercial for them. But they are friends of ours, and we're excited about their technology. This is a really powerful magnet that's sealed in a plastic case that can be covered with a sterile drape. This is the device that has been developed that is basically a grasper that we can grasp tissue with. In particular, for our purposes, we tend to grasp the liver. It's atraumatic, which means it doesn't hurt anything. You can sit there and clip it on anything you want. It doesn't do any harm to the tissue, and it allows us to move tissue around. So let's make believe this was someone's abdomen, and we were picking a piece of tissue up. We needed to move it over, lift it up out of the way. We can do that. We go in, we take that, find it where we want it, then we bring the magnet in on the patient's abdominal wall, and then we deploy the magnet. So here we've moved tissue out of our way, deploying our magnet, exposing the area that we want to operate, because as you know, the stomach lives beneath the liver. So by lifting the liver up out of the way, we can do our sleeve or our band or our bypass here, and we haven't had to put a retractor in. We haven't had to put another incision in. So we're using the existing port sites or trocar sites that we already had. Then when it's time for the surgery to be over, we're going to go back in and we can reconnect our technology. We remove the magnet. Obviously the tissue doesn't slam down like it does in our model. We remove the magnet, remove it from the tissue, and voila, we're done. So this is just the beginning of this technology. There are new products in development that are going to allow us to move our camera around better and get fewer and fewer incisions. Smaller and smaller holes means less and less pain. You don't have to be a rocket scientist to understand that. And so we're really excited to be on the cutting edge of this technology. And if you're appropriate for this, talk to us about it when you come in for your consultation to see if you're appropriate for magnetic surgery. So that's what we're excited about today. This new technology is right beginning to come into our market and be exposed. So I think you'll see more and more of this. If you have questions, give us a call here at Ultimate Bariatrics, and we'll be happy to talk to you about the benefits of magnetic surgery. That's it for today. Thanks. We'll see you soon.